require our community working together to try to correct it. Lewis County is just one of the many statewide county communities coping with this. This afternoon, we're going to hear from Mr. Jim Scordo, Ms. Andrea Neal, Dr. Dan Paisanello from Cradle Community Center. They're going to speak on opiate use and treatment. We also hear from a community member who will share her experiences. At the end of the presentation, there'll be an opportunity to ask questions. Before I turn this over, here's some Lewis County specific data from the New York State Office of Alcohol and Substance Abuse Services and the Department of Health. In 2016, there were 283 admissions to Oasis Services for substance abuse problems. 43% of these admissions cited opiates as the primary substance. Please note that these are admissions, not unique individuals. In the first 9 months of 2016, 84 unique Lewis County residents were admitted for problems with opiates to Oasis programs. And in 2016, there was 11 reports of the administration of Narcan in Lewis County by EMS and law enforcement. I just want to point out that substance abuse treatment is voluntary on the part of the person. You cannot force somebody into treatment. And it usually takes a person multiple attempts at sobriety before they're able to report sustainable abstinence. So I'm going to turn this over to Mr. Jim Scordo, who's going to report out on...
Jim, would you and your guests like to come right up front, take my chair? You're more than welcome.
Or I can sit right here.
I
don't want to take the chair's seat way up high there.
I want to make sure everybody gets a chance to hear you and see you.
You tell me, where do you want me?
I think you'd be clearer up here.
All right, I'll go up there.
Yeah,
If we can handle
yeah,
that.
you're better off going around.
Go around the other side.
I can turn on the speakers too if you like.
I don't need to sit there. Good evening. Thank you for having us here this evening to talk to you a little bit about the opiate and heroin epidemic that we're experiencing, not just in Lewis County, but in every community throughout the United States is dealing with this. Andrea is handing out a packet of information on the right-hand side. It gives you an overview of the services that we provide in the Lewis County Clinic on number 3 Road, where we share space with Mountain View Prevention. There's also a flyer in there that talks about the opioid treatment program, and Dr. Dan Paisanello will talk to you a little bit about that. On the left-hand side, I've included some information that provides educational information about the opiates and heroin epidemic that is going on. Cradle's been around doing substance abuse services since 1973, and in the fall of 2013, we stepped into Lewis County after discussions with the Community Services Board and the Board of Legislators, and we started providing substance abuse treatment in the Wildville Clinic in the fall of 2013. I've been doing this for over 30 years, and in 14 we started looking at the number of deaths that were occurring. Individuals that we had successfully completed program were on the right track, and yet then suddenly died from an overdose. Every indication was they were on the right path. And as I started looking at that, it said that in doing homework on that the opiates and heroin impact the brain in a different way than any other drug. And they're at a much higher rate for relapse. So we started looking that perhaps we need to be offering more services. We started that in 2014, visited some programs in Syracuse and in Plattsburgh. And then in February of 15, we're asked by the New York State Office of Alcohol and Substance Abuse Services if we were willing to open an opioid treatment program in Jefferson County to serve the North Country. And we looked at that as being the Tri-County, Jefferson, Lewis, and St. Lawrence. And we continued our homework on that, submitted our application in October of 2015, and our opioid treatment program opened in September. Just to give you an idea of the magnitude of this problem, if you were to take the heroin problem of the 1960s and the 70s, and the cocaine problem, the two most highest periods of death due to certain substances, if you were to take those two time periods and add them together, they do not compare to the opiate and heroin deaths that we are seeing today. This is an epidemic that New York has never seen, and to be honest, many other states are in the same situation. Why such a spike in the opiates and heroin? And Dr. Paisanello can tell you from his perspective that what he saw as a doctor and the expectation being placed on doctors to treat the pain. And pharmaceutical companies really started marketing new pain medication. Oxycontin was a big one that was pushed awful hard. They spent millions of dollars marketing Oxycontin. And in 2007, Purdue Pharma, the pharmaceutical company that was pushing the Oxycontin, they were fined $600 million because they did not inform consumers or doctors of the highly addictive nature of this substance. So since then, they have had to pull back and send a new variation of Oxycontin that was informed individuals, as well as less likely to be able to cut that up and to snort that and use it in other ways that would be harmful to individuals. We also see that when if you've had a surgery or if you've had a wisdom tooth pulled, that you're often given a 30-day supply of painkillers, when in reality you may only need those for a couple days. So some new legislation that's been passed in New York is limiting the number of days that painkillers are given. Rather than a 30-day supply, they're going to start off with a 10-day supply, and if somebody needs more, then they would get that renewed. And that will start to shut the supply off and stop feeding this. But this is not a problem that's going to go away overnight. This is a problem, and I was at a speaker that statewide and nationwide known, Mike Murney talked about it, but this is something we're going to be dealing with for the next 5 to 10 years. It's not going away. And what do we need to do? I believe that it's a three-pronged approach, and much like the public policy efforts that have targeted substance use in the past, it's a combination of law enforcement, it's prevention and education, and educating our students, our youth, our families, our community, and providing treatment. And I believe we need to do all three of those. I'm going to ask Andrea to touch base a little bit about our Lowville clinic, and then I'm going to ask Dr. Paisanello to talk to you about our new opioid treatment program that we're operating in Jefferson County. Andrea, if you could give a little overview on the Lowville service.
Oh, you're going to be right in the center of attention. You need to go around.
Let's go around here.
So as Jim said, the Lowville Clinic is, Prego took over the Lowville site on number 3 Road in 2018. We offer comprehensive evaluation, so anybody can come in and have an assessment completed to determine whether or not treatment is necessary. Walk-ins are on Tuesdays now from 2 to 4. And individuals are sent for assessments from a variety of different places. And also, as Jim said, can't force anybody into treatment. So we can offer a recommendation for treatment, but then it's up to the individual whether or not they want to accept recommendation. We do group and individual counseling. We have several different types of groups, and so a group schedule is individualized to the person and what they need. So we have some individuals who will come every day for group, or 4 days a week, and then have an individual session for that 5th day if they need more engagement in treatment. And we then have individuals who will only come for group 1 or 2 days a week and then have an individual session every other week. It all depends on where the individual is in their treatment and in their recovery. We offer care management services. We have case managers who are involved with the care homes, health homes. So they come out to the Lowville site from Watertown. And those counselors also, besides doing health homework, they also help our clients with vocational work and help really just to get individuals to resources that they need. So if they need help with housing, and along with the vocational, a lot of people don't have a resume. They don't know how to interview. They don't know how to do a lot of those life skill things that a lot of people take for granted and were taught in another way. So we have counselors that come out and do that. Discharge planning would be if somebody needs to go to a higher level of care for whatever reason, we work through that process with people all the way through. And then also, if they are completing treatment successfully, they have the option to continue in treatment with us. Now with the state, they have a continuing care program where a client can choose to continue to see us once a month just to have engagement with us, because a lot of times that's what they need and what they want. And but also in discharge planning, we want to make sure that we have a plan set up with the client that they know what they need for themselves. Who do they need to talk to? What resources do they have set up for themselves? So we do all of that with them. For family support, we have a family support group the first and third Thursday of every month at 5 o'clock. It's free for the community. You don't have to be involved in the program in any way, shape, or form. You don't have to have a loved one in the program or anything like that. So anybody can come. And along with family support group, you do not have to be a user in order to be in the program. If you are the significant other of somebody who is using and your life is impacted by substances in any way, you can be a client in our program, and we tailor treatment to your needs, because everybody's life is impacted by substance use, not just the person using, but also family, anybody who loves the person who is using. So we absolutely can do counseling and do counseling with people who are impacted by somebody using. The Suboxone program, the opioid treatment program that Dr. Paisanello is going to talk about is in Watertown, and that's daily dosing. We are able to have Suboxone for non-daily dosing with Dr. Paisanello, and that's on a case-by-case basis. So that would have to be determined by the doctor and the treatment team for people who are appropriate for that level of dosing. 7 Challenges is an adolescent program, and it's geared for individuals under the age of 21, and it's an approved OASIS program. The other sites that Credo, the other sites we have available are, we have 2 halfway houses for men in Watertown. We have a women's intensive residential program in Watertown, where the women they live in the house, they do all of their treatment in the house. If they have children under the age of 3, they can have their children in the house. And then we have an adolescent intensive residential program as well in Evans Mills. where they live at the farm, they get all their treatment at the farm. And then they normally step down and reintegrate back into the community. Any questions?
I have
we have-
Dr. Paisanello go on, and then we'll do press questions at the end.
About any of
You got 8 so far.
All right, so we'll send Dr. Paisanello. Okay, we're ready.
this? I have to wait to see.
Uncomfortable after a while, isn't it?
That chair is gonna be open in December or January if you're a December resident.
Thank you for inviting us. Addiction is a condition that has social aspects, psychological aspects, but also biological aspects. And treatment is more successful if you do all three rather than just focusing on one or two of them. So, with regard to the biological aspects, which is kind of my area of expertise, let me just talk about how we think about addiction. And I'm going to use the example of opioids, although it can be applied to other substances as well. Opioids being heroin, fentanyl, morphine, oxycontin, oxycodone, hydrocodone, Vicodin, Percocet, etc. So we know the body has receptors on its cells for opiates. The brain has receptors on its cells for opiates. And why do we have them? It's because we have a certain amount of our own natural opiates in our system that are there all the time. We call them endogenous opioids. And if you have the normal amount circulating, you feel normal. If you have a little more than the normal amount circulating, you feel better than normal. You've heard of like people go out and run 20 miles and feel great instead of feeling all sorts of pain, the so-called runner's high. The thinking is that these people, by running, they somehow trigger a release of their own endorphins, they're called, the body's natural opioids, and they feel a little better. And so, and some people more than others, and there's definitely either hereditary or genetic differences between people and how they respond to opioids. But we know there are some people that they take some opioids in addition, like they take a Vicodin pill or they shoot up some heroin or something, they feel really, really good because they have more than the normal amount of opioids there. And they feel so good, it's difficult for them to stop using them because they feel so good when they're using them. But what happens after a while is the body knows that there's more opioids going into the brain than there should be. And after a while, it takes steps to reduce the flow of opioids into the brain. It makes it harder for opioids to get into the brain. That leads to what we call tolerance. Somebody who's been taking opioids either for pain or to get high realizes that the same amount of opioids they've always used doesn't do the job anymore. It's because it's harder to get in the brain. So to get the same effect, they have to take more than they did before. Also, if that person were to stop using opioids completely, now all they have is their normal opioids in the body, but those opioids would have a harder time getting into the brain because of the changes the body has made. So all of a sudden the person feels worse than usual. And if it's mild, they can just feel a little uncomfortable. If it's bad, they can go into full-fledged withdrawal, which from opioids means you're going to be sweating, nausea, vomiting, diarrhea, runny eyes, runny nose, anxious, pain everywhere. It's really quite miserable. So what we see is these people that started to use opioids to get high, by the end they're just using opioids to feel normal or just not to get sick. And so it makes it very difficult for them to stay away from opioids. So several decades ago, back in the 50s and 60s actually, the ideas came out, maybe we can look at this as a disease in some aspects, and there may be a way to treat it to help these people from relapsing. So they came across methadone, which is an opioid. It's a very long-acting opioid. And opioids that are short-acting are more likely to give you the high because they come into your system real quick and then they get out real quick. Whereas methadone is kind of like a steady state. And they thought, what if we can give these people just enough methadone? They have that extra opioid in there, but they're not in withdrawal anymore. They're not high either. They're able to function. You just give them the right amount, that sweet spot in the middle where they're not craving to use. And if you can do that, maybe you can stabilize their life. And if we stabilize their life, they come in and get their dose every day, but they're not out there committing crimes, sharing needles, engaging in promiscuous sex, filling up our jails, maybe even after a while, holding down a job. And we have people in our clinic from all walks of life. We have people that don't have a high school diploma or a GED. I saw someone just this week that has a master's degree, and all walks of life. And we have some people that have been in treatment for a long time. We're a new clinic, but we had a person transfer in from out of state, and she's been on the same dose of methadone since 1997. And she would come in every morning, get her dose at 7 o'clock in the morning when we open up, and then go work a full day's work at her job. So that's the idea behind it. And methadone can be dangerous. The federal government allows it to be prescribed for addiction only at certain specialized clinics, like what we have now, our opioid treatment program. We're open 6 days a week, 7 o'clock in the morning to 10 o'clock in the morning. People come in for their doses. They come in, they're observed by a nurse. If there's any question about whether they're acting right, they're tested. They're tested randomly anyway. They get liquid methadone, which they drink right there, mix it with water, drink it, and then the nurse makes sure that they've consumed it all, and then they leave. And then they come back the next day. And for some people, just the structure of that, having to come in every day, knowing they could get tested, knowing they're going to be observed, knowing they have a place to go in the morning, helps them, I think, a lot of times, almost as much as the medication does. You have to be careful with methadone, because if people take too much of it, they can overdose. So that's why they're monitored, and I see them quite often and monitor their dose and make sure they're not on too much. The other drug we use, both in Lowville and in Watertown, is Suboxone. Suboxone is similar to methadone. It's not as powerful as an opioid. It doesn't work for some people, but it's safer. And so, because it's safer, the government allows us, instead of just dosing it at the clinic, to send a prescription to the pharmacy for people. They can go to the pharmacy just like any other prescription and pick up their Suboxone supply and take one every day. What we do at Credo is we call people in randomly halfway through their prescription, random times during the prescription, to make sure they still have all their Suboxone, they haven't sold it. We even make sure that the lot numbers on the wrappers that they bring in match the lot number on the prescription bottle label that they get from the pharmacy, to make sure they haven't traded with other people to get their Suboxone. And they're tested frequently, randomly as well. For people that we don't trust enough to do that, we have them come to the clinic in Watertown every day. You mentioned daily dosing. They come to Watertown every day and take their Suboxone while being observed by a nurse. They don't keep their Suboxone on the person. We have a Suboxone supply there, and we dose it to them. The other medicine we use is Vivitrol, which is which is an opioid blocker. Okay, now you might have heard of Narcan, which they use in emergencies. Narcan is great for emergencies because it works quick, but it doesn't last very long either. Whereas Narcan, or naltrexone, which is Vivitrol, takes longer to work but lasts a long time. In fact, in the shot form of Vivitrol, it can last 4 weeks. So a person who's not on opioids but wants to try to stay off opioids can come in every 4 weeks and get a shot. It's going to block the effect of any opioids taken in the next 4 weeks. That's very useful. There's some problems with it too. None of these medicines is perfect, and none of the medicines have been shown to be effective without counseling and the other services we provide at both our Lowville and Watertown sites. And I'll be able to answer questions later. We have one of our star clients who would like to talk.
Is that okay?
How are you more comfortable?
I'm nervous.
Introduce yourself.
Hi, I'm very nervous. I don't like talking in front of people. But my name's Katie Farney.
It's okay.
You're among friends.
I am a 15-year opiate addict. I have 2 kids. My mom. Sorry. I know Larry is, so he's kind of making me a little okay. This clinic, I've been in and out of rehabs, in and out of jail. I've stolen, I've lied from my mom, a lot of people. This clinic has, I'm 6 months clean. This clinic has helped me a lot. I go in every day. I know I get up every morning. I have a purpose. Like I get up every morning, I go get my dose. I feel good. Like I'm going to work on my recovery every day. I'm going to be an addict for the rest of my life. It's no doubt about it. This is just like a little, thank you. This is like something just to help me. I don't want to be on it for the rest of my life. You know, it takes away my cravings. It takes away my sickness. I didn't choose to be like this. I didn't wake up one day and say, hey, I think I'll be an opiate addict. I think I'll shoot up for the rest of my life. I didn't choose that. This is a medicine to help me, just like somebody on like a diabetic or somebody with cancer or something. This is just a medicine. I have a disease. Okay, this is a medicine to help me be okay, to help me maintain my life. I lost my family. I lost my mom. My daughter hated me. She wanted nothing to do with me. And in the last 6 months, I lost 10 people very close to me to heroin overdoses, and it's crazy. I promised I wouldn't cry, but if everybody would just, like, you can tell an addict 20 times a day, all day long, you gotta quit, it's good for you, your life sucks. Like, I was homeless, I lost custody of my kids, like, I had nothing, and then, yeah, I still wanted that drug, I still craved that, I still had to have it, and I didn't care who I hurt, I didn't care what I had to do to get it, I had to have it, and,
How did you turn things around?
actually, I got into the meth, and I got busted. I got busted for manufacturing in the third. I went to jail, which was the best thing for me. I'm not saying it works for everybody, but it worked for me. While I was in jail, I lost 6 of my friends, close friends, to a heroin overdose. And I had a lot of time to think. Like I said, I've been in rehabs. 30 days isn't good enough. 30 days for a 15-year addict, that's nothing. Like, I'm still finding myself. I still have a long ways to go. I'm not cured. And I'll never be cured, but I'm trying. You know, you can tell somebody every day, like I was saying, for 20 years. And if they're not ready, all you can do is be there for them. All you can do is try to help them. But if they're not ready, you know, they're not going to do it. Like, I just can't thank the doctors enough for this methadone program. Like, it's just an amazing thing. I never thought that I would be able to live. I have money, I have my family, I got stuff now, you know? And it's just an amazing thing, and I just wish everybody, I got a second chance. Like, this is my second chance to live, and I'm gonna take it, you know?
Was there one day though that you just?
One
said,
day
"This
I
is
just
it"?
said, you know what? I said, I watched a lot of my friends, I've watched them overdose. I've brought a lot of people back from an overdose. Narcan them, CPR, whatever I had to do. And just one day I was sitting there and I heard a friend had died, and I read his obituary. I said, you know, that could be me. That could be, my mom could be burying yet another kid. And I'm not ready to die, you know. And I said, I promised myself that I would never use again. And I haven't. It's been 6 months. And the methadone program is working great. I go to my meetings. I go to my counselor. I see Dr. Dan. It's just such a hard, I had a rough life. And it wasn't because my mom made it that way or my dad. It was I made it that way. I made the choice to use. And if I could take it all back, I would. It's just, we're still people, you know, we're still individuals, we're still human. We just made some wrong choices in life, and you know, and this program has helped me so much that I'd be dead. If I wasn't on methadone, I'd be dead right now, and I'm not lying. Like, if I didn't go to jail and I didn't get clean, I'd be dead.
So,
There's no doubt in my mind.
Katie, first off, congratulations.
Thank you.
Absolutely.
You said going to jail was really good for you. Is that because it gave you the time to think, but you didn't have the drugs?
Yes.
Is that you were forced not to be
Yeah.
able to have drugs? Is that part of it?
Yeah, I felt good. Like, I woke up and I didn't have to worry about where am I going to get that next buzz, who am I going to lie to get the money, who am I going to steal from, and I felt good. Like, I felt human. I wasn't sick. Like, I chased that drug, and I didn't care what I had to do to get it. I didn't care if I had to steal from my mom, my kids. I didn't care if I had to leave my kids. Like, and I thought, man, I feel good. I started looking better. Like, I just felt like, man, I just felt good. I felt good about myself, and I had so much time to think. And I went, you know, so much time to be like, why? You know?
How long were you in jail?
I was in jail for 3.5 months. I did
So, like, how long did it take for this transformation to come to you?
Probably a good month and a half. I mean, it takes,
I imagine it does.
it takes
yeah.
a while. Like I said, I've been using for 15 years. It started with pills, and I was taking 80 pills a day at one point.
80 pills a day?
I was taking 80 pills a day, and that was just to be, I could take 30 just to be okay. Like, just to be normal like I am now. You know, just be able to talk or get out of my bed or whatever.
I was gonna ask Dan this, but you're a better spokesman. With people that didn't start because they had the pain and all that, they started maybe because peer pressure or whatever. Like, was it the euphoria that grabbed you from the
sensation.
Oh,
the
Oh
high?
my goodness! If I was snorting it for a while, and and then I started using IV. It's just all of a sudden you just get this rush of, oh my gosh, everything's okay. Oh, like you just relax, and it's just this rush of warmth and just like, oh, I feel good. Let's go, you know. And then you're down, and I have mental health issues, so I like it blocked all that. It blocked all the bad things in my life. I thought one little drug would block it, and it did. But when you're sober, it's still there, and it's worse now. You know, after you come to and you're not high anymore, now you're sick, and then now those problems are still there. Like, they're not going to go away by one line or one shot or one day. You have to work at it.